Okay, students, as you can see, we're not starting off on the same slide that we were before. There's two slides that are pretty much review, so I decided to skip those and jump right into the vascular system of the brain. So really important here, you have the external carotid artery, you have your internal carotid artery, then you can see your vertebral arteries coming up through the vertebral frame, and the vertebrals come up into the basilar artery to the posterior circulation. There is a little communicator right there, so it communicates to the anterior circulation, so that's called the posterior communicating artery. The internal carotid artery comes up to the carotid siphon and goes to the anterior cerebral artery to the middle cerebral arteries, which will be coming straight at us, so it's hard to see in this image. We have better images for you. So coming up, you can see your right and your left, I'll call them the verts. You'll hear me just refer to the verts, right and left verts. They go up into the basilar artery. Here you can see we have the left and the right internal artery. They come up, and then you can see your middle cerebral artery, and coming up front is your anterior cerebral artery. Really important that you see your basilar artery. We had a case where a radiologist missed that finding, that it was not patent, which means open, and it was a young patient, and he actually was sent home, came back like 6-7 hours later. They called me in stat, and I scanned him, and he had the whole posterior portion of his brain was wiped out due to lack of blood flow. We life flighted him out, and he is a vegetable. So very important that you see that. Don't miss it. Here is your internal carotid within your carotid canal. So you can see it, the carotid artery there, your internal, with contrast in it in the canal that you guys had studied. So here's your sphenoid sinus to kind of give you a baseline where you're at. Here's your basilar artery. So this is common. What we do is we take and we cut out all the brain anatomy just so we can see the actually MRI. It's called an MRA. It's an angio in the MRI scanner. So this is your internal carotid. Here's your siphon coming up. Right through here you have your anterior cerebral. Here's your verts coming up to your basilar, to your posterior. This will give you some idea of what I'm talking about here. Main thing is I want you to know your basilar coming up to your posterior. Here is, I don't want you to know too much, your anterior cerebral. Yeah, I'm not going to make you know all these little ones coming up. Hard to see. So anterior artery comes forward. You have your communicators in between. So anterior communicating artery, you have your middle cerebrals, your posterior cerebrals, and you have communicators between the two. So you have your middle cerebrals, you see your basilar there. We're still pretty low, so we're not high enough yet to see the posterior circulation. You can see your right and your left vertebral artery coming up and merging with your basilar artery. So here's a cutout also. So this is an angio. This is your vertebrals. I'm not sure if this is spun and how far it's spun. I would assume this is the right and the left, but I can't say for sure. Coming up is your basilar to your siphon, and then we have your, oh, I'm sorry, no siphon with this one, just your basilar up into your posterior arteries, and we spin it so that you can see if there's any filling defects. Here's another view. This is coronal. It's an angio CT. Here's your right and your left verts coming into your basilar. So right vertebral artery, left vertebral artery coming up here, and this is your, these two right here is your internal carotid artery with your middle carotid cerebral artery, sorry, with your anterior. In between here, so this one and this one is your communicators, and this back here is your posterior communicators. So anterior communicators between your anterior cerebral arteries and your middle cerebral arteries, there's the anterior communicators, and then posterior between your middle cerebral arteries to your posterior circulation, you have posterior communicating arteries. So this is an axial view. This is easier for me to understand and probably for you in addition. So coming up here is your this is your right internal carotid artery. This is your left internal carotid carotid artery coming up, and then we have the middle cerebral here and a middle cerebral here. We have the anterior communicators right here coming to your anterior cerebral. And then posterior, you have posterior communicator there, and here's your posterior communicating artery. This is your right or your left vertebral and your right vertebral to your right, or to your basilar artery, which goes to your posterior circulation, which merges with your communicators. So if you have a blockage of your basilar artery, you do get some feed, but you're going to have ischemic to cell death because these little communicators aren't enough to feed the brain with the blood supply that it needs. So here we have the middle cerebrals, the anterior up front. Here's your suprasellar cistern. This is your ambient cistern. Within the ambient cistern is your posterior circulation, so your posterior cerebral arteries. And here is your CT, and this is your anterior communicating artery, or anterior cerebral artery with your anterior communicators with your middles coming out. And this is your posterior communicating arteries with your posterior circulation. So this is kind of the lay of the land here. Here is your anterior communicators, anterior cerebrals, middle cerebrals, posterior communicating with your posterior circulation. Here is your right and left verts coming up to your basilar. So hopefully this will get easier as you look at it more and more. So here's the venous system. This is your superior sagittal sinus coming all the way down and around. So it's the big fat rope. When it comes down to the back, it all comes together to a confluence. So it's a confluence of the sinus back here. You have the transverse sinus coming around and your sigmoid sinus coming down. Now you can remember the sigmoid because it kind of looks like the sigmoid colon, right? It's not as extreme, but it's still there. So your transverse comes here. Up here is your straight sinus, and then you have your inferior sagittal sinus. So here's your superior sagittal sinus. This little guy right here is your inferior sagittal sinus. You see it better on this would be an MRV, so this is a venogram. So superior sagittal sinus coming around. Here's your confluence. Transverse sinus, this is actually coming straight at us right here, and here's your sigmoid. And then your straight sinus is here, and your inferior sagittal sinus is right here. So you can see your superior sagittal sinus on a CT is a little more dense. Here's your straight sinus and your inferior sagittal sinus. You have your great cerebral vein here. This is a MRI. It's a special sequence that we run. It's a spin density, but it's weighted kind of funny, so we can see the vessels. So you can see your anterior communicators, your superior sagittal sinus coming around the back. You have your straight sinus with your, yeah, I don't make you know those two. This is looking at the venous system, so this is the MRV, and we have cut it out so that we can see. So this is your superior sagittal sinus. Here's your confluence and your transverse. So when people take steroids or birth control pills, guys that take high doses of roids, they'll get little blood clots back here. And women who fly after having birth control, when they sit for long periods of time, get little blood clots in there. So that's where we're looking. So you can see it here, right transverse, left transverse, and that's where we're looking for blood clots. So as you can see, the pituitary gland is here. You have your internal carotid artery. Really scary if there's a tumor because it'll grow right around those internal carotid arteries. So you have your sella turcica and your cavernous sinus. There's a little spot right here, and tumors do grow within there, so it's important that you see that. So here's a coronal section of CT. Here's your pituitary gland, your cavernous sinus, your sphenoid just below it. And there's a little junk in that sphenoid, a little thickening. So the drainage, so we come superior sagittal sinus around to your transverse down your sigmoid. This is a pretty good image because it shows you your superior sagittal sinus to your straight sinus to your inferior sagittal sinus. I like that picture. Excuse me. So we have the hippocampus, we have the infundulum, and the pituitary gland. And I want you to know here we've got the olfactory tracks. So that is something that that I'll have marked on a couple films. And your optic nerve, as you guys know, with your pituitary gland. So in your suprasellar cistern, just above that, which is right above your pituitary gland, is your optic chiasm where the optic nerves cross. So we've covered this before. So we have the lens, we have the superior rectus muscle, the optic nerve, the inferior rectus muscle. We have retroorbital fat in the globe. That's the posterior portion of the globe. So you can see here your optic nerve where it crosses at the optic chiasm, which is just above the suprasellar cistern. And the Meckel's cave, there's a nerve that runs through there, and there's tumors that grow within that area. So the doctor will refer to Meckel's cave. I just wanted you to be aware that there is such a thing. So looking here, we've already covered a little bit of the inner ears. So we have the CPA here and the basilar artery. I can't see it in this image, but it's there. We have cranial nerves 7 and 8. We have the cochlea. We have the semicircular canals with the vestibule just right above that. Here you can see 7 and 8, the nerves, and this is the jugular foramen to kind of give you an idea where we're at. And this is the olive right here. That is the extent of the brain. So there's 100 slides. I'm going to upload them for you so you guys can follow along if you'd like and look at them independently and study them so that when you get to lab, when we look at the brain, you'll be able to label the different images. Important that you also do the ASRT module. That'll help you in understanding what you're looking at. Okay? I'll see you in lab.